Assalamu alaikum. Welcome back from the ad break. You are still watching Prime Live. Now, joining us in studio is our wellness expert, Ronald Abvajee, and we will be talking about World Heart Rhythm Week. He's going to be enlightening us on ways to maintain a healthy heart rate and also prevent serious complications. Assalamu alaikum, and thank you so much for joining us on Prime Live.
Wa alaikum salam. You and Maimuna took me to prayer earlier when I heard the assumption on what the normal heart rate numbers are.
We were way, I don't know. I don't know if we were way off. We'll find out when you let us know. But before we get to that, let's go into the first question of the day, which is World Heart Rhythm Week aims to raise awareness about arrhythmia. Could you maybe explain what arrhythmia is for those who do not know and how it affects the heart?
Absolutely. So, number one is arrhythmia is to do with an irregular heartbeat. It's a broad term for irregular heartbeat, and there's different types of irregular heartbeat. Now, we know that in South Africa, 1 in 10 people will suffer with something called AF, or atrial fibrillation, which is the most common type of erratic and irregular heartbeat. Now, the difference between arrhythmia, blood pressure, and heart rate.
Yes.
So we spoke about that earlier. So blood pressure is the pressure that your heart pumps blood into your vessels. And that is an average measurement of 120/80. That's the normal range. Maimuna?
120.
120, Maimuna. Not the verpa of 180.
180. 180 is a bit, yeah, if you think of it, that's
It's
a lot.
scary. It's
Yeah,
scary.
It's scary.
And then your heart rate is how many times your heart beats per minute. And the normal range that you look at is between 60 and 100 beats per minute. And that's when you get that rhythm of the heart. You can count your pulse beats over 15 seconds, multiply it by 4, and you get an estimate of what that number is. Arrhythmia involves irregular heartbeat because your heart utilizes electrical signals to stimulate the ventricles, the bottom 2 chambers, and the atrium, the upper 2 chambers. And when those electrical stimulus comes through, the muscles contract, so you get that rhythm. And when you have irregular electrical stimuli or problems with the rhythm of the heart, that can be life-threatening, and that's why this week is so important.
So, speaking about obviously having an irregular heartbeat rate, does it mean that it's pumping slower than it should or faster than it should?
So you get different types. There's a tachycardia and there's a bradycardia. And that means a slower irregular heartbeat or a faster irregular heartbeat. So it's not beating as per normal, which maximizes the blood that gets pumped. If your heart rate or your heart rhythm is slightly slower, what it means is that blood could pool in the atrium. So it doesn't pump all the blood out. So it means you could, feel dizzy, you could feel lightheaded, you could have a stroke. It could lead to blood clots. And if it's beating too quickly, you're not pumping enough blood because it's not allowing enough blood to get into the chambers to pump. So it could be fast, it could be slow, or it could actually be irregular. And that's what atrial fibrillation is, especially in the upper chambers of the heart.
Thank you so much for shedding light on that. And how can we reduce our risk of developing arrhythmia, such as, let's talk about dietary changes that we can make or lifestyle changes?
Well, the number one thing is awareness, because yes, it's electrical issues, but it's also, impacting other components of the heart. So diet is a leading indicator to what could be a lagging problem. A lagging problem with arrhythmia is obesity, diabetes, and certain other non-communicable diseases, hypertension as well. So those are impacted directly, not just by genetics, but because remember, genetics is like a loaded gun. Your lifestyle is pulling the trigger of that gun. So it really mitigates those things. So activity, managing stress, what you're eating is critically important, and you're following a heart-healthy diet. So a lot of your fruits and veggies, cutting out on a lot of fatty red meats, processed foods, etc., because you don't want to put your heart system under additional pressure, especially if you have an irregular heartbeat or at risk of an irregular heartbeat.
And let's talk about World Heart Rhythm Week. The purpose of it is to obviously highlight the importance of regular screening and early detection. Can you talk about how impactful that is to always go for screenings? Because people don't do that. I've never been for a heart screening before. So I'm the first one to be guilty in that aspect. So tell us about the importance of doing that.
think many of us are. It's not just you. I think we wait till something happens before we choose to intervene. Now, we know that like hypertension, which is another heart disorder that we're dealing with, which is high blood pressure, we also know that arrhythmia is often not picked up. And when it's not picked up, we can't intervene earlier. And there you boil down to you could get medication, you could get a lot of things. But you can't manage what you don't know. And if you don't know, you need to go get screened to know. This is why an annual health screening is critical. They could do an ECG, a resting ECG. They will pick up the different rhythm of the heart. It doesn't take a lot of time, but it's absolutely essential to ensure that you are not one of the 10 people in South Africa or one of the 1 in 4 globally that could be impacted by arrhythmia or atrial fibrillation as you get older.
I mean, you mentioned that a lot of people obviously go through the screenings only after they have experienced problems. Now, let's talk about the early detection signs. When do I know, or when does someone know? What are the signs that they might actually have irregular heart health, or something is wrong with their heart, or they might be experiencing arrhythmia?
It's fairly generic concerns that we look at, because you could say, but those are similar signs and symptoms to hypertension or to having a higher heart rate or a lower heart rate, right? So what you do is we need to be aware of palpitations. If there's a lot of palpitations in your chest and you find that it's pounding against your chest, you don't know whether it's a regular heart rhythm or whether it's a high blood pressure issue. The second thing you have to look at, if you have dizzy spells and feeling very faint. Now, the irregular heartbeat and the pounding is also if you do small bouts of physical activity. If you're unfit, it doesn't mean you have an irregular heartbeat. But it could mean that if you find yourself walking up and down stairs or carrying packets or short bouts of activity that's functional, go have it checked out. Fainting and dizzy spells is another one that you need to be aware of. And those are some of the big ones that we look out for. But ultimately, it's really about the awareness, because you could even get irregular heartbeats or arrhythmia from birth. Because you could also be dealing with physiological aspects of the heart over and above the electrical irregularities. So be very mindful that it's not an older person issue, it is an any age issue.
And let's talk about stress. Can stress be a contributing factor to it?
Absolutely. I think stress is a contributing factor to many of our ailments, and the heart issues are in particular. Why? Because one is it increases the level of cortisol. Your body's in flight or fight, you're releasing adrenaline, so it means the heart rate is increasing in its rate. That means that your risk of potential irregularities, especially with electrical impulses or stimuli, is a lot higher. The second thing is, when you're stressed, you often find your sleep is irregular, you're not eating healthy, and so forth, which could compound that a hang of a lot more. And lastly, you're not sleeping enough. And we know that sleep is a time where the body nourishes, rejuvenates, regenerates, and it gives you the opportunity just to calm down. The biggest thing with stress is it's a compounding factor to many ailments, but in particular, it could be an initiating factor to exacerbate a potential arrhythmia issue.
And just speaking about technology itself, what role do you think technology plays in, diagnosing and treating arrhythmia? And also, how are innovations shaping the field of cardiology and improving patient outcomes?
It has been phenomenal. I think technology is something that is giving us the opportunity to identify earlier, address quicker if we are willing to use it. Now, there's use from a consumer perspective or patient perspective, there's use from a medical practitioner perspective. On the medical practitioner side, advancements in technology, genetics, and so forth, even medications, has been shown to improve treatment and identification of arrhythmias a lot earlier and to treat it more successfully. But also from consumers, there's devices that you could now have. I mean, I have a wearable device. This means I understand my numbers. Whether I choose to act on those numbers is another story. But it means that daily I can track what is happening to the best of my ability within my body for me to make more informed choices. Is it critical with technology advancements? Absolutely.
Thank you so much for sharing that with you. And as we wrap up, can you maybe give us any words of closing or advice to our viewers at home watching right now on the importance of, looking after your heart, but also just making sure that you stay woke to the signs, early detections, screenings that you've spoken about? Just any final thoughts?
You remind me of speaking about something that I grew up listening to, the heartbeat. Doof, 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 doof. doof, doof. And the minute you have an irregular heartbeat, imagine it gives me palpitations, never mind the irregularities. You need to know your numbers, because the heart is not in isolation, and the risk of arrhythmia is that it could lead to a stroke, it could lead to hypertension, and it can lead to death. It could lead to blood clots, because when your heart is irregular and beating irregularly, those blood clots can spread throughout your body and you can die. Now my thing for you is this: I don't want to deal with the risk of, maybe I do, maybe I don't. I want to deal with the risk of, if I do, I know what I have to do, and if I don't, I know what I need to do to prevent. Prevention is better than cure, and this is an ideal example of go for your screenings, go for your assessments, use the tech, and let your heart beat to the rhythm of life rather than beating at a risk of death at any minute.
Thank you so much for sharing that with us, Ronald. But before we wrap up Viewers at Home, we do have a video from Professor Pamela Naidoo on what heart disease is. So let's take a listen.
Professor Pamela, what is heart disease and why is heart disease awareness so important?
Yes, so heart disease, it's a term that captures many types of conditions, which what we call circulatory conditions. And when we talk about circulatory conditions, it's, literally if you imagine the blood flow through your system, your bodily system, but particularly around the heart and the brain. But with heart disease in particular, we need to ask ourselves, well, what condition causes the heart not to function to its maximum capacity? And often that's through various means. There are different types of heart conditions, and so, for example, if you have heart failure, you may not know this, and you may have it over a period of time, and then you will end up possibly with a heart attack or other severe conditions of heart failure. So, for example, when you get tired, and you don't question it, you're constantly saying to yourself, oh, well, it's a stressful life that I lead and so on. And then cumulatively, over time, you end up being really, really, really ill. Now, if you combine that, because that could be also a structural issue. When I talk about a structural issue, it means that the heart as a muscle is not functioning properly, So it's one of the vessels or your arteries or that whole, the anatomical structure of the heart is not functioning well. And if you combine all the risk factors with your family history, for example, of heart conditions, as well as your risk factors like being hypertensive or diabetic and other negative behavioral risk factors, that can end up, you can end up having, for example, atherosclerosis. You could end up having a cholesterol condition because your dietary factors are making the fat sort of content of your blood a little higher. So the bad cholesterol. And then it lines your vessels and it causes, obviously, clotting to occur. And then when that passes through your actual heart structure, the muscle, is when those problems occur. So that's kind of how your viewers need to understand it. It's complex. It's not just like having a heart attack is equal heart disease. No, it's not like that.
Viewers at home, that was an amazing video that we just watched with Professor Pamela Naidoo on what heart disease is. And on top of what Ronald already said, I hope this is leaving you very well informed on exactly what a healthy heart should look like or feel like, but also just encouraging you to look after your heart and do regular screenings and make sure that you are, looking after yourself so that you can live longer and have a healthy heartbeat so that you can enjoy your life. But without wasting any time, this is the end of the interview. We look forward to having you again with Ronald next week, same time, same place. So for now, let's go to a quick ad break. We'll see you right after this.